Don't sacrifice a beautiful smile because you're afraid of the dentist. We'll learn about sedation dentistry that you've been hearing so much about the commercials. It really is putting a smile back on the faces of millions around the country. Hey, when was the last time you went to the dentist?
3 months ago.
Really?
Yeah, I go 3 times a year, 4 times a year.
Why?
Just that's the way you keep
those dentures in?
Yeah. All right, that's it. That's
come
it.
on,
I'm leaving.
Just kidding. Finally, to sit by myself. Coming up, we'll ease your fears with a dentist who promises a pain-free, well, painless and near-perfect smile. And Kirstie Alley isn't the only one in Hollywood to dramatically gain and lose weight. Coming up, we'll share the secret weapon stars use to shed the pounds in a matter of days. I will be paying attention. And here's a hint. They say it's all about metabolism. Look at him grinning through his teeth.
This is NBC6 South Florida Today.
I'm just sitting here looking at some incredible before and after pictures, which we'll show you in just a second. If you are like millions of people around the country who truly fear the dentist, the mere mention of a cleaning can make you break out in a cold sweat. Wouldn't it be great if you could just go to sleep and wake up with a straight, white, beautiful smile? Well, joining me now is Dr. Lee Weiss, who's a specialist in what's called sedation dentistry. I'm sure you've heard of that terminology of late. It's you hear a lot of commercials on the radio now about sedation dentistry in the last couple of years.
That's right. Mm-hmm.
How did you, Doc, get into this specialty of dentistry?
Well, I took a residency in dentistry, and then I got an interest in anesthesia. I was going to become an anesthesiologist. And I took a 2-year residency, and I decided to stay with dentistry because I felt so much compassion for patients who were so fearful of going to the dentist. They would break out in a cold sweat, as you said. It became the worst nightmare in their life. So if I could make it easier for them and more comfortable, I really got an interest.
Are you the person, if someone's going to get anesthesia, are you the person that does it?
Yes, I am.
So you are, in effect, really an anesthesiologist, close?
Yes, I am.
You do both?
I do both.
So a couple questions come to mind right away. There are different kinds of sedation. I mean, you hear on the radio the talk of, we give you a pill. This is not a pill. There are various, how out does somebody have to be? Is it based on the extent of the work or the extent of their fear, or both?
It's more based on their fear. I'm not really a sedation dentist. What you hear on the radio is a procedure where patients get a pill or medicine to make them a little sleepy. But they're awake, but they don't remember very much, but they're just sleepy, but they're still awake. On the other hand, I make you completely asleep, so you don't remember anything, you don't feel anything, and you wake up, it's completely done.
Can you do a whole lot more work when you do that?
Oh, absolutely. We have patients asleep for 3, 4, sometimes 6 to 8 hours at a time.
Couple of before and after pictures, and you tell me, is this the kind of thing that you can do in one sitting?
Well, no, that's more of a complex case. It'll be multiple visits, but multiple long visits. She had 4, 5, 6 hours at a time, and maybe 3 or 4 visits.
All right, let's take a look at this one too.
Same with that gentleman.
Huge difference. Yeah. Now, were these people? I mean, do you find that a lot of your patients do have this fear that we hear about?
Oh, absolutely. In fact, there's another picture of a very pretty woman who that one,
Okay.
And she was just terrified, just absolutely terrified. And she walked around, beautifully dressed. She was an executive, and
kept her mouth closed, I bet.
She would have her hand like this when she spoke very often, but her fear just kept her from doing what she needed to do.
And so you put her out.
She was completely asleep. Yes.
What about, well, two questions about full anesthesia. Aren't you, and isn't the patient adding a risk to the procedure that wouldn't be there where they're not anesthesia?
Sure. The anesthesia has a risk. The risk is very minimal. The difference in what we do as opposed to hospital anesthesia, we don't rely on the anesthesia for relieving the actual pain. We give local anesthesia as well. So we don't need to give the anesthesia. It doesn't have to be as deep. It's not, the procedures that we do are not as invasive as in an operating room in a hospital, but our office is completely set up as if it was an OR in the hospital.
Really?
We have EKGs, all the monitoring equipment, all the anesthesia equipment, resuscitation equipment, and we really have had minimal problems in the 30 years I've been doing this.
Is anesthesia, when necessary for the patient's fear, covered by insurance?
Usually not. Now this is an elective, a luxury that patients take to overcome their psychological fear. It's not, insurance companies don't view this as a necessity.
Well, they don't view a lot of things as necessary that really should be.
But when you see someone who is panicked and in such incredible fear, then how do you say this is not necessary for them?
So not unusual for them to cover the procedure, but not the anesthesia.
Exactly.
Okay, what are we talking about? What is
on
the
the
cost?
average, it's usually $1,000 in addition to the dentistry. It could be more, it could be a little bit less, but that's on the average.
And what do you think the addition of this option for some patients has meant to their lives?
Well, these people have stayed away for so long. It's been, and many patients, it's a daily problem. They wake up, their social life is affected, their work is affected, they psychologically they don't feel good.
Have you changed lives?
Have I changed lives?
Yes.
Absolutely.
Okay.
Absolutely.
Doc, thank you very much
My
for being
pleasure.
with us. You can visit Dr. Weiss and his associates at 817 South University Drive in Plantation. That's in the Fountains Medical Plaza, just west of Fort Lauderdale. And if you'd like more information, or if you'd like to schedule an appointment, just give them a call at 954-424-6500. Kelly?